Hello and welcome to Women's Health. This is a collaboration between the Mayor's Commission on Women and Channel 10 Health. Today we're going to be talking about midwives and doulas. My name is Kathy Ermacher. I'm the chair of the Mayor's Commission on Women. I'm joined today by another commissioner, Pat Shepard, and our guest today who will be talking about midwives and doulas. First of all, we'd like to welcome Joanne Bronson, who is a certified nurse midwife, and also Marcia Dvorak, who is a doula. So let's get started, first of all, Joanne, by just telling people, what is a midwife?
There are several different types of midwives. I'm a certified nurse midwife. I had to have an education in nursing, and then I went for an advanced degree to become a certified nurse midwife. We sit for a national board, and we are licensed to practice in Nebraska. There's also direct entry midwives in some states where a woman decides that she wants to learn the midwifery skills and usually does an apprenticeship with somebody who has some experience who teaches her the hands-on skills. And then there are certified practical midwives, which they actually take a certifying class, and there are schools like in Seattle where they actually do go to school, but they are not nurses.
Okay, and they are not practicing in Nebraska, or they are?
They are not practicing currently in Nebraska.
Okay, great. All right, so let's just talk about midwives for a little bit. It seems to me that there's been a lot more discussion about midwives in the last couple of years, maybe 10 years. I think when Pat and I were having our children, nobody ever talked about midwives, and I don't think anybody really knew that much about them. When I was having my children, it wasn't the case. Although certainly we do remember historically, obviously, yes. You know, people had midwives, you know, when grandparents and stuff talk about having home births, whatever. But then now, in my daughter's generation, a lot of them talk about midwives. So let's talk a little bit about what the services of a midwife is, what they do, and that kind of thing.
Okay, first midwife came to Nebraska in 1992, so we've been around for a while. I started my practice in 1993. And what we do is we provide women's health care. So I do gynecology. I have clients who are menopausal and postmenopausal, and we also do childbirth care. Usually we have a smaller practice than a physician. We take less clients because we spend more time with our clients. We do lots of teaching. I have appointments with my obstetric patients that are half-hour long. We'll go through anatomy, physiology. We talk about nutrition every visit that they come. We talk to them about fetal development, things they can do to make their baby healthier and to make their pregnancy healthier.
Okay.
And for our pregnant moms, we also do labor support. So when they go in and labor, we don't just come at the end to catch the baby. We go there, rub their back, feed them ice chips, walk the halls with them, and really become involved in their care. And at my practice, we stay for an hour after birth. We help our moms get breastfeeding going, and we do a special bath with the mom and baby in the bathtub jacuzzi afterwards. That's kind of fun. We also do a lot of education afterwards. We talk to our clients about postpartum blues, postpartum depression, and spend a lot of time educating them.
And breastfeeding, is that part of that?
Breastfeeding is definitely part of that.
Okay, interesting.
So how much does a person pay then for your midwife services?
The fee range varies from practice to practice. At our practice, it's about $2,800. That includes all their obstetric care. As far as my fee goes, it doesn't include, obviously, the hospital. So even if I see somebody every day because of a complicated pregnancy, their fee remains the same.
Okay.
But that is for a vaginal birth. If they do become a cesarean or something, there are additional fees. And it's just a little bit less than our physician fees.
So you said something about certification. Could we talk a little bit about certification and what the status is in Nebraska, for example?
In Nebraska, according to state law, only a physician can do a home birth. The Nurse Midwifery Practice Act actually forbids us from doing home birth. If we do a home birth, we could lose our license. So there's, I think there's about 20 of us now in Nebraska that practice midwifery. Omaha has the highest concentration, and all of us do in-hospital births. We do have to sit for a national board and pass it. And then we have to recertify every 5 years, and we're required to keep our RN license also. So we have to do continuing education just like a physician does.
So in Nebraska, I'm
Okay.
sorry, Pat. Just in Nebraska, then you said something about in Nebraska. So there obviously are differences in other states.
Yes,
Okay.
there are 2 states that supposedly don't allow home birth, and I believe the other one is Arkansas. So it's Nebraska and Arkansas. All the other states do allow home birth. In other words, people are not prosecuted if they help a mom deliver at home. Even Iowa allows home birth.
Do they have to be certified?
No.
Really? Even in Iowa, they don't have to be certified?
No.
Interesting. And is that's the legal status then in Nebraska?
That's
is
the legal
that-
status in Nebraska right now. Now, there are some other states that may start to require the certification for the direct entry midwives has just started, I believe, in the last 5 or 6 years. So it is something that we may see increase in where states may say that you have to be certified.
And the direct entry would then be the person who goes to the home.
Right. Well, actually the certified midwife, who is not a nurse, would be able to do home births, but she would then possibly, some states might start to license her just like they license us.
Okay, interesting.
So now, if a person does use a midwife, is that covered by insurance?
Most insurance companies do cover it. That was a battle I had to fight being the first midwife in Lincoln. And when I first started, nobody would cover me. But I got lots of help from the newspaper and from a state senator here, and we have been able to get pretty much almost every insurance company to cover us here in Nebraska. But believe it or not, it doesn't go state to state.
Oh, yes, I'm sure that's really true. So you said $2,800, and then that covers your fee from start to finish, basically.
Right.
So what about then the physician? What role does the physician have then with your clients, for example?
The physician doesn't play a role unless I invite him in.
Or her.
Or her.
Right.
If there's a complication, like I have a client that needs a cesarean delivery, then we ask for a physician to step in. But we still stay with our clients. So my clients who go for a cesarean delivery, I go back to the operating room with them. I also go to the recovery room with them and make sure they get to breastfeed their baby in the recovery room. I stay right there with them for at least an hour after they give birth and serve as their advocate.
Wow, and so the physician isn't there at all then?
No, he doesn't come unless I call him or her to come and help me.
But
so
you
if I
do-
needed forceps or vacuum extractor, I would have to call a physician to help.
Sure. But you do then you work in a physician's practice yourself? Or
I
do you have
work
your
with-
own practice within another practice, or is it?
I work with
Conjunct-
4 physicians, but when a client calls in, they ask for me or ask for a midwife, and they are my client. So the physician won't see them at all during the pregnancy unless we identify that there's a problem. Like if I have a twin mom, then I do collaborative care with the physician, where I will see her and talk to him after each visit, and he or she will be present at the birth.
So if there's any chance for complications or anything different, but other than that,
Yeah.
you're it.
I'm it.
That's great. Okay, Marsha, let's talk a little bit about doulas.
Okay.
I think probably from my experience, there's a lot less known about doulas, maybe. So let's talk about what a doula is and kind of the same types of questions. Let's just start out with, what is a doula?
Well, we were named doulas in I think 93 or so by Penny Simpkin. Part of DONA International was Doulas of North America, now it's international, called us doulas. Prior to that, we were labor assistants or labor support people and so on. The training for doulas is very good from a standpoint of DONA, and there's a couple other companies that also do so. But that certification helps train the doulas, and our role is from the support aspect versus the clinical aspect.
Okay.
So there's a lot of people who can go in and help in labor that do well in working with the family, but with the training, we've got a lot of things that are non-pharmacological pain relief methods and changes of position and things that we can do to help bring comfort to the family. But it also helps from a evidence-based perspective. It shortens labor a little bit. There are less meds asked for, not necessarily where that woman comes from. If someone has a doula, It doesn't mean they can't ask for meds or any of that, but it's kind of interesting how those non-pharmacological pain relief methods can help early on. But it varies in regards to the long term, but there are less cesareans, you know, less interventions of all sorts on the grand scheme.
And then now, are you independent as an independent person? Do you
I am
contract
independent.
with the mother?
I contract with the mother and her partner. And so I can go anywhere from pro bono with a family who doesn't have money to pay for it, that wants my help, to $350 is my fee. I've been all the way in between those, and there are people who just love the care and they end up paying more, but I don't ever ask for it. So it varies. Doula to doula in Nebraska, that really varies too.
Okay.
Okay, there are some people who charge much more and take less clients. I don't take very many, but when I have them, you know, I like to serve them. So,
Sure.
How does someone find you? I mean,
How does
do they
someone
know-
find me?
How do they know you're out there?
okay, in Lincoln, it's word of mouth. I've been doing this for about 24 years. I've trained doulas since, I don't know, 95, 6, you know, so I've been around for a long time. So the referrals that I get for childbirth education classes, I'm one of the founding members of Milkworks, so I'm a lactation counselor, so my name will get out there. Other people who've had me offer my name, and so it's word of mouth. I haven't had to put up the old website. I could, but I might get too busy. I don't know. But it's just right.
But now you mentioned DONA, which we should explain a
Please.
little bit. What is DONA? That
Doulas of North America was founded by the bonding physicians, Marshall Klaus, Phyllis Klaus, and John Kennel. There was Penny Simpkin. Was a group about 7 to 8 individuals that formed DONA. But the bonding physicians who brought out the research for bonding also researched doula care, and this is where they discovered there was evidence-based benefit of having a doula. And so they educated the medical community, and it kind of went from the coasts in.
okay, and that is the organization then that is your certifying
Yes.
agency.
Yes. Absolutely.
Okay, so if someone hears of a doula, they want to be sure that they are a DONA certified.
I would highly recommend, because there's a lot of people who go in and call themselves doulas. Okay, that can happen with anybody.
Okay.
But the training is important, and the respect that comes from knowing someone's trained and certified makes it a little disparity in regards to that. And so it's important for someone to think about, if they want to become a doula, to really go into educating themselves. DONA is the premier organization. That's where the experts are. The data that goes into training doulas from that organization is premier. And that's also where the respect from the medical community comes. So if Joanne recommended to have me teach a class, that's separate, or postpartum care, breastfeeding, or doula care, she gives that information. Okay, so someone can look up on DONA and find my name there and see that, you know, I'm a doula that's currently certified or have trained doulas, whatever. They can get all of that and verify it. But they'll also learn a lot about DONA if they go onto that site. So dona.org is the website, and there's all sorts of educating perspectives there.
So following up on Pat's question, if someone in Lincoln is interested in a doula, and let's say you're busy, could they go on the DONA website then and find
They
other
could.
people who are in Lincoln? I mean, is that possible? They're
Yes.
all listed there.
Or
then.
they call me and I give them a list of names.
Okay.
Absolutely.
So now, do the doula services get covered under insurance?
No, but we're trying.
Okay.
Okay, so people will ask, you know, I want my insurance to cover. And that can really vary. And the first answers for people a lot of the times are no's. In Nebraska, though, there has been coverage, but not from covering doula as a medical expense. It's like the flex programs where people have money pulled out
Oh,
that
sure.
are,
Yeah, that makes sense.
you know, not taxed or whatever. And then sometimes that will fall in that category for some insurance companies and not for others. So it varies a lot. So I tell people, file, 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 you know, and then remind them not to take the first several no's, to keep filing.
That's true.
Yeah, absolutely. So we're getting there.
Oh, that's great.
So what are the things that lead a woman to reach out to you and ask you to assist her with her birth? I mean, is it the lack of drugs or?
You know, that would be an easy prejudice.
Okay.
To think, oh, I don't want drugs, so I'm going to have a doula, and sometimes that's how you're hired. Others, it's like, I know I need extra support, or I know my partner needs extra support, but I won't want to tell him he needs extra support, or vice versa. He's going to be with me, I need someone to feed him, and so the roles that we play as a doula in a labor situation vary a lot. I sought out a doula when I was looking to have a VBAC. My first baby was born by cesarean, and with our second one, we needed support. And that's how I found our doula, and this was before we were called doulas. And so that's kind of where it comes from. You begin to start asking around and people will give names. And that's kind of the beginning. Now we have evidence-based information. The DONA website's out there. There's a number of them that are out there. And it varies a lot. But a lot of caregivers will give my name.
What does doula mean? Why did they choose that
It's
name?
actually the woman servant of another woman. It's a Greek word. It's actually in the original, the Greek version of the Bible. The doula was a woman servant that was most likely around at the time of birth.
Interesting.
Let's
talk a little bit about the relationship between the midwife and the doula. I understand you've worked together before. Okay. So how does that work? Do midwives usually work with doulas? Do doulas usually work with midwives? Does it make any difference, or how does that usually go?
I think it kind of depends on the midwife. I work with doulas a lot. People always say, but Joanne, why do I need a doula if you're going to be there? And my answer is, I take more than one client due in a month. Even if I only had two of you, you could both be in labor at the same time, and then I'm going to have to divide my care between the two of you. And I rotate call with my partners. So sometimes my clients don't get to know my partners as well as they know me. If they hire a doula, she's theirs and theirs alone. So sometimes that makes them feel a little more secure about, okay, if my midwife isn't on call and I get one of the midwives I don't know as well, at least I know Marcia's there, and Marcia knows what I want, and Marcia knows what will make my birth experience positive. And that's what we feel our role is to support the women in having the birth they want. So if they want an epidural and they want those things, they will absolutely get them. And midwives have lots of clients who come to them who plan on having an epidural, and that's fine with us. Our role is to support you and help you to get the birth that you want.
One of those clients who may also have that entire list, what happens when the midwife comes in is then I switch my role. Okay, so she gets right down in there with the mama, and then that's when I feed the dad, or that's when I pick up the camera. You see, so it's like I switch gears when the midwife comes in, and so I think that is huge. The other aspect of it is you've got women who are giving birth in all sorts of situations, including medications that they're planning and so on. And they're just as pleased to have my help in those situations as if also I were serving a midwife. And so we're all my role as serving as the mother, but I switch depending on what the needs are in the room.
And I think she does a lot of doctor births too, and you know what you have to remember when somebody comes in that's a doctor client, they're meeting that nurse for the very first time and going through labor. And if shift changes, all of a sudden they've got a new nurse that they have to try and bond to. You guys remember that.
That's true.
And Marcia stays
true.
with them. That doesn't change. Marcia doesn't say, okay, my shift's over, here's the next doula. I mean, we've been together sometimes for 36 hours helping a woman birth. So the wonderful thing for the client is that continuity, knowing there's one person who's going to be with me the whole time. There's not going to be a change of shifts. She's not going to leave me until I'm ready for her to leave me.
That's great. Very great. Do we have any sense of how many midwives births or doula births there are? I mean, statistically, do we keep track of that?
You know, I called the state trying to find out. They don't really, at least the people that I talked to couldn't help me much. So I went to the Nebraska Friends of Midwives, which is a wonderful organization here. The last statistics I could get were for 2007. And we were doing, for the whole state, 20 of us, about 5% of the births, which actually is quite a few. At one of the hospitals here in Lincoln, there are 6 of us that work here in Lincoln. We did 25% of the births last year.
Is that right? Wow. That's amazing. That's great. Great.
It's a harder number to cover with doulas.
With doulas.
Because you've got all sorts of kind of doulas out there.
Sure.
And so as far as the trained ones and, you know, the caregivers that I know take care of them, my ratio in regards to the populace that delivers is much smaller, but on the other side of the coin, that's increasing. So I can't really give you a number.
Right.
Because they don't have it tabulated on their stats at the hospital.
Right.
They monitor the clinical,
Sure.
not the doula. They should monitor the doula. There's a lot of states that do. But
So it does
not here.
vary from state to state in that regard as well.
Yes, oh yes.
And does certification and all those kinds of things vary from state to state with a doula also?
That's all over the place, okay? But the certified doulas, the ones that have respect from that perspective, are more likely to be documented. Does that make sense?
Yes.
So it does vary.
Sure.
And
Sure.
for some, it doesn't matter, you know. So I don't know the numbers to give you. I did try.
Well, statistics are statistics, right?
That's right.
But it is very interesting to get some sense of that, and as we said, it's obviously growing very
Yes,
much in
yes.
popularity, which is fantastic.
Yeah.
And I think that right now there's a lot of sort of concentration in healthcare. The healthcare industry, obviously, everyone is looking at the healthcare industry today. And I think that giving our audience some opportunities to hear of some of the variations of the childbirth experience are really important. And that gives us sort of a way to let them know something different that's going on. And obviously, there are a lot of people that are making that option or switching to that.
Yes.
So you said there are 6 in Lincoln, okay, and then out of the 20, about how many in Omaha?
You know, that changes. I'm not positive, but I would probably say there's, of the 20, there's about 10 in Omaha. And then
Okay.
there are 2 way out in Norfolk, and I think there's one in Scottsbluff. And then the 6 of us here.
Okay, and these are the ones that you know for sure.
That I know
because-
for sure, and they're all certified nurse midwives. There are some certified nurse midwives here in Nebraska that aren't practicing right now, and I'm not counting them. These are practicing nurse midwives that I'm counting.
Okay, okay. And you said that it's illegal to do a home birth in Nebraska.
That's the fill. Now, it's never been taken to court and proven that a judge would agree, but state law says you have to be a physician to do a birth at home. It is absolutely illegal for a certified nurse midwife to, because in our Practice Act, it does forbid us from doing a home birth.
Okay. But is that changing? Do you see that coming differently?
There's a bill currently before the legislature that we've tried for, I shouldn't say there's a group of people, not necessarily the certified nurse midwives of Nebraska, but there are a group that are trying to get it legalized here, and it's coming up soon, we hope.
Well, that's great. Do you happen to know what bill it is?
No, and I
No,
should have looked
okay,
it up.
that's fine. No problem, no problem. But it is important to know that the legislature is moving on that, and I think it would be fun. It'll be very important for us to watch that as it
And
goes
I'll be happy to
forward.
get you the bill number that you can post with this if
That
you
would
like.
be great. That would be great, because I think it's important for us always to stay abreast of what's going on in the legislature when it comes to
Yes,
women's issues.
absolutely.
I agree.
And things change all the time. We want to thank our guests today, Joanne Bronson and Marcia Dvorak, and we've been talking about midwives and doulas. We want to thank you for being with us, and Pat, thank you. This has been Women's Health. If you are interested or if you have a topic that you would like us to cover under Women's Health, please let us know. We're always looking for issues and topics that interest women in our community. Again, this has been Midwives and Doulas, and thank you for joining us on Women's Health.